This last step, principle of Tropin, I'm just going to mention very briefly because this is an optional step. But what happens in the human body as we age, we have a reduction of certain hormones in our body. One of the most vital hormones that we have a reduction in is called growth hormone. Tropin is the first substance that has been shown to clinically increase growth hormone levels in the body. It's a growth hormone releasing hormone analog. It mimics the action of natural growth hormone releasing hormone in the body, and it results in a natural increase of growth hormone that your own body makes. So normally, the only way to increase growth hormone is by injecting growth hormone, a synthetic recombinant substance, into your body, and that the levels come up. Whereas with Tropin, you're sending the same message as your body normally made at a higher point when you were younger, and the message goes to the pituitary gland and tells the pituitary gland, hey, make more growth hormone. So it's your own endogenous means what your body makes itself, your own endogenous levels of growth hormone that come up. And the studies that have been done show within the first 90 minutes of using Tropin, in 117 patients that we measured using chemiluminescent radioaminoacid levels of growth hormone, 463% increase of your own body's growth hormone levels within the first 90 minutes of usage. Within 5 weeks, from baseline to 90 minutes, over 1,754% increase in endogenous growth hormone levels. Now, what does this mean? What this means essentially is that the growth hormone that we're producing now is your own body's growth hormone and allows you to re-establish the same physiological parameters that you had when you were younger, anywhere from 5 to 20 years back. The problem is that with growth hormone injection therapy, growth hormone levels go up, but the goal of therapy seems to increase a substance called IGF-1, insulin-like growth factor type 1. Now, everybody remembers that insulin is good or bad? Bad, because it's pro-inflammatory. Insulin-like growth factor is very similar to insulin, and it actually also is pro-inflammatory. And in actuality now, there have been more than 100 studies done to show the correlation between increased IGF levels and cancer. So the goal of therapy with these the doctors that are using growth hormone injection therapy is to increase your IGF level, but that causes cancer. Tropin is the first substance that increases growth hormone, but reduces insulin and IGF levels consistently. Cortisol levels have been measured, pro-inflammatory molecule levels consistently drop. IGF levels have been measured, pro-inflammatory molecule levels consistently drop. Insulin, pro-inflammatory molecule levels consistently drop. But the most dynamic aspect of Tropin is the subjective response that patients experience. From athletes to people in their 90s, virtually everybody has some positive effect. Statistically, 8 out of 10 people continue using Tropin. Some people aren't in tune with their bodies and can't appreciate some of the changes, and some people expect a euphoric event, and it's not a euphoric event. You don't feel stronger. You don't feel like you can do more, have more endurance, yet people within 3-4 months are experiencing better concentration. Things that used to bother them don't bother them. They're getting off their antidepressants. Within 2 weeks, a week, people experience changes in sleep pattern. They don't need as much sleep, but yet their sleep is more it's a deeper sleep, because your REM sleep, which is the rapid eye movement sleep, which is a deep state of sleep, actually increases from 1.5 hours to maybe 2 hours. The reason we know this is because people start reporting more vivid dreams. The dream activity increases. So there's a whole cascade of events that takes place with Tropin. It increases your growth hormone levels, but in actuality, it also causes an accentuation of all the hormonal responses in your body. So you have all the sex hormones that go up, all the different thyroid modulation, everything starts to increase. It doesn't necessarily replace anything, but it does, with the exception of thyroid and with the exception of progesterone. I don't use anything else for any type of hormone. No DHEA, no pregnenolone, nothing. We haven't found that to be necessary because Tropin seems to take care of it. The only things are people that may be thyroid deficient may still need some thyroid, and women with severe hormonal problems may need some extra progesterone. The contraindications are if a person is pregnant, or if they have a pituitary tumor, which prolactin level or an IGF level has to be drawn. And there's a lot of other information on Tropin, but I think that I'm just going to stop it here, and then we'll be able to take any questions. Right now, there are 2 options for patients to increase their growth hormone levels. And using Tropin, we're actually getting more than just increasing growth hormone levels. But the 2 options are, 1, injectable growth hormone, or Tropin. Now, when you compare the two, the price of injectable growth hormone ranges anywhere from $1,000 to $2,500 per month, whereas Tropin is $175 a month to $200 a month. The more important issues than just price is the efficacy. Transi-Tropin results are evident within the first, anywhere from the first 2 days to the first 2 weeks, whereas with growth hormone injection therapy, most patients can go 3 to 6 months and never experience any of the changes themselves. And we've got numerous cases of doctors themselves that were on growth hormone injectable therapies, never saw any benefits 3, 4, 5, 6, 10 years out, and then starting Transi-Tropin within 2 weeks could see the benefits. So from an efficacy standpoint, you see results much faster. The type of results you see are much, much more pronounced with Transi-Tropin. And the nicest thing is that the side effect profile. With Transi-Tropin, there has been no side effects, unless you consider acne in patients that are 40, which to me is proof positive that you're reverting the physiology to that of a younger state. Or in some patients, postmenopausal women have started menstruating again. Well, they haven't been happy, but it again shows proof that you're reverting the physiology to that of a younger state. Whereas with injectable growth hormone, there are many, many side effects that are known. Carpal tunnel syndrome, joint effusions, acromegaly, all these different types of problems, cardiomyopathies, they're not side effects that really anybody wants to deal with. So from a cost perspective, it's better. From an efficacy standpoint, it's more effective. From a response time, patients experience changes much faster. And from a side effect profile, it's much safer. So there's really not much comparison. Oh, and the last thing, who wants to take an injection when you can put drops on your skin and rub it in?
I think there are some cases in medicine, and I can speak to some in dermatology, but also in medicine in general, where, you know, patients just can't seem to get over a hump, and it's hard to explain why. You know, they're treated appropriately, you're trying to do all the right things, you seem to be tackling all the issues that are at hand, and there just seems to be a block in being able to take it to the level where you know the patient could go. And I think Transi-Tropin is a way to potentially unblock that, help patients get over the hurdle, to just feel better. Just feeling better a little bit can change a person's life immensely.
When did you begin Transi-Tropin?
Started Transi in about October of '99.
About 4 months ago.
About 6 months altogether.
How did you feel when you began Transi-Tropin?
The first night that I started on Transi, I noticed that I slept much better. I'd always been one of these people that had numerous interruptions in my night's sleep, and that first night I only woke up once.
Third or fourth day was when I started feeling things. There were changes in my appetite, things that I wanted to eat and didn't want to eat.
Well, that was much different, much stronger. I felt much better.
Did you feel an increase in endurance, stamina, strength?
The endurance and stamina, that probably took a couple weeks before I recognized any difference, because big thing I was looking was for weight at first, and then the other things came about.
I felt much stronger. I could work longer, had more energy, and looked better too.
I like to play golf, and usually by the 5th or 6th hole of golf, I'm tired. I'm ready to leave. Never played more than 9 holes. And around 2 months after I started on Transi, I noticed I felt really great. Finished the whole 9 holes, and so I signed up for a tournament and finished the whole 18 holes. At the end of the tournament, I felt great. Invited everybody that was on my team to come and have dinner at my house. And beforehand, I would not have had the energy to do that.
Did you experience any changes in your skin or hair?
Drastically. I had a whole lot of little crow's feet through here, and they're pretty much gone now, and I haven't changed anything as far as skincare. I haven't changed makeup type, what I do in the evenings or in the morning as far as cleansing. I haven't changed any of that, but I've definitely noticed that. I noticed age spots that were on my hands have started to disappear.
Much improved in that direction, yes.
Shaving was a lot easier, believe it or not.
Did you experience any changes in your mental focus?
I think I did, because working in the mortgage business, you're constantly dealing with numbers, trying to figure out how to put things together for someone's home loan.
I don't forget nearly as badly as I used to.
As far as patient care, I can remember really quick what somebody's IV formula is.